Hey folks, it is another Thursday and another Essure Removal day. Just wanted to show you two particular cases. This first one isn't like super exciting, but you can see the right fallopian tube here coming down. And right there, you can see a little nubbin of that Essure kind of poking through that tube. So the tubal anatomy itself is pretty normal. And the left tube, normal, coming down right there. But it's this right tube, and this is just in her normal anatomy, just like the way that the uterus normally sits. So you can see that coil is just kind of poking through. This other lady, the next one that I'm going to show you, she's had pelvic pain on the right side, kind of what she calls a pinching for the last few years since she had the coil inserted. I don't know about you, but this is the right fallopian tube right here, and you can see that that coil right there is not in the tube. A little bit bigger of a picture. That Essure coil is, the tube is right here, the junction right here. The coil is coming out through the uterus, right on the side of the uterus. I'm guessing, and this is a guess, but it's probably that this is the way that that was put in. I don't think that this probably was a migration as much as it was a perforation. So I just wanted to talk to y'all about Essure removals because I've done about 700 of these. I'm going to say, and this is a grand statement, but I've probably done more than anybody in the world, and I've seen a lot of crazy things. But one of the main things that I've seen in this lifetime is that this hurts, and women are being told that that doesn't hurt. Or they're not even being given the opportunity to find out if this hurts because they're being told that the coil itself doesn't cause problems. Well, that looks like it hurts. If that was sticking out of a testicle, that would hurt. I told the patient's husband today, if you had that sticking out of your testicle, would you think that would hurt? Of course it would hurt. It looks painful to me. So those coils need to come out sometimes, and it's okay to take them out sometimes. So here's the rub. I take coils out. I've done probably close to 700 now. I find that most women that are coming in have hormonal imbalances, pelvic pain, bleeding. Now, also, it's not every woman. I mean, there are women out there that have hysteroscopic sterilization coils that aren't having problems. And so I wouldn't say that those necessarily need to be removed. But like you saw in this video, those ladies had significant problems and they need to come out. And I've also had women who have coils that are in the right place. You do the surgery and the coils are in the tube. So I'm just gonna go over a few things. One, you wanna make sure that you have your coils removed by somebody that knows what they're doing. You don't want somebody that's dabbling, that's experimenting, that has only done 10. If they say they've done a lot of Essure removals, ask them how they're doing the removals. How are they removing the coils from the uterus? Are they cutting the tube open and pulling? Are they cutting the tube off? Or are they removing the entire tubal tract with the coil still inside the tube? You want to know, you want to have them draw you a picture of how they're going to get that coil off. Not every woman needs a hysterectomy. Not every woman wants a hysterectomy. If you don't want a hysterectomy, you don't need a hysterectomy. So what I'm going to say, and I'm going to put it here real quick, is that to make an appointment, and this could be a consult on the phone, it doesn't need to be a decision to do surgery, it could just be you trying to find out information. You can call the appointment line and just set something up. I have women that, I had a lady the other day, today actually, one of the surgeries I had, she had a hysterectomy. She was still having problems. The doctor that did the hysterectomy would not order her an x-ray even though she was having problems, and she actually had another coil. There was a coil because they didn't remove the tube on the right side. Vaginal hysterectomy, a straight vaginal hysterectomy without laparoscopy is a no-no in my opinion because you can't always get the fallopian tubes, and that's exactly what happened to this lady. So call the office if you have questions. I still take all the insurance plans. I really would like to help if I can. I've done probably close to 700 of these, so I think experience is great, and it's volumes, and it means better care for you. So let me know if you have any questions. You can leave them in the feed below, and I look forward to answering those. Bye.